gentlemen, my name is Jocelyn Poche, and today I'm going to briefly discuss with you a common STD in the U.S. known as trichomoniasis. Yeah, I said it, trichomoniasis. Believe me, it was kind of hard at first, but if you're looking at me and you're wondering, what is that, or what did she just say? My point exactly. If you don't know what it is, or you don't know how to pronounce it, my advice to you is to stay safe and wrap it up. Trichomoniasis is considered to be a very common STD in the U.S. and oftentimes goes unknown because the symptoms are undetectable. Usually between 3 to 28 days after the initial sexual intercourse, some symptoms may be prevalent, but yet again, they're often undetectable. The infection is caused by a single-cell bacteria that affects the genitalia area of both men and women, but most commonly, women are the ones who oftentimes are infected. Approximately 3.7 million people in the U.S. have trichomoniasis, but only about 30% of that population actually know that they have it. According to the Centers of Disease Control and Prevention, a recent study showed that the prevalence of trichomoniasis is about 2.3 million among women ages 14 to 49 years of age. About 85% of the population of the women who participated in the survey showed no signs or symptoms. The study also showed that African American women's prevalence is about 13.3% compared to white women's 1.3% and Mexican women's 1.8%. It also noted that the prevalence of the disease in African American women increased with age and lifetime sexual partners. The most common way of transmitting the infection is from one infected body part, such as your vagina or your penis, to another uninfected body part. However, this does not just include vaginal intercourse. It can also include anal and oral sex, masturbation, and sharing of sex toys, because all of these sexual activities do involve exchanging bodily fluids, which increases the risk of transmitting the disease to your sexual partner. Despite the fact that the symptoms do go unnoticed, here are a few of the symptoms and signs to watch out for or to take more cautious. A whitish, yellowish discharge from the vagina or penis. Painful or frequent urination, or perhaps both. Painful intercourse. And itching or irritation inside the penis or the vagina area. The most common treatment is usually in the form of an antibiotic pill that can be prescribed to you by your local physician or doctor. Further treatment and options are also available and can be obtained by doing just that, taking a visit to your local healthcare clinic and talking with your doctor and physician and being as open as possible about your sexual activity or your sexual history, so that way proper treatment and diagnosis can be taken into account. For other questions or concerns, please take a notice at take a notice at some of the websites that will be available at the end of this video. Thank you for your time. Hope you enjoyed. Should I say, hope you learned some valuable information from this brief announcement. And just for the heck of it, these tatas and this weenie, they can be a lot of fun, ladies and gentlemen. But if you don't use this and this, wrap it up, you might just end up with one of these. Thank you.